Yeah, we could use both of these. With the description of moxibustion that I give to all patients, because this is unfamiliar. Most people are familiar with the needles being part of acupuncture treatment, but needles and moxa are by definition Chinese medicine. The name of this practice, this whole practice of medicine in Chinese, is pronounced Jinju, which means needle burn. So the needles and the burning of the moxa are by definition Chinese medicine. The needles move the energy around that's present in the system already. The moxa acts like a transfusion of energy into the acupuncture channels. So when we're doing moxa on someone, we're actually giving them an energy transfusion. So what I'm going to demonstrate for you today, and what we're going to practice on each other, is called the energy restoration technique. It's a real easy way of giving your body a transfusion of energy. What it does is we do the moxa along the lung channel, starting distally and going from distal to proximal along the lung channel up to lung 1, from lung 11 up to lung 1. And then we go crosswise under what I call the necklace, and we're going past lung 1, stomach 13, kidney 27, and CV 22. And we're going both ways, back and forth. And then the last pass is starting from CV2 down at the superior aspect of the pubic symphysis and going up the conception vessel all the way to CV22. So I drew this diagram for you so you can remember the direction of flow. What we're creating here, going from distal to proximal on the lung channel, is we're creating an intentional afflux, A-F-F-L-U-X, flow of energy into the lung channel. Lungs are the masters of the energy, right? So if your lungs are feeling low, if you're tired, at 3 o'clock in the afternoon, if the professor's droning on and you're falling asleep, this is a handy little technique to know. So if I could have my lovely assistant here, lie down face up, please. When I'm teaching the patients to use moxa at home, I introduce them to how to light it and how to put it out, stuff like that. So I'm going to give you guys the same rant. So I tell them that what's contained in this stick is an herb called mugwort. It's the common name of it. Artemisia vulgaris is the Latin name. And when you burn this substance, it releases the medicinal qualities from the herb that penetrate the skin and allow it to fill up those acupuncture channels. To light it, this one's already been lit once so you can see the burning end, but if you get a brand new stick, it looks like that on the other end, on both ends, so it doesn't matter which end you light. So I'm going to light the end that's already been lit. And you have to use a lighter or a candle flame. A match won't burn long enough to get it lit. And this is trying to run out of fuel.
I have an extra lighter if you want.
I think I might have gotten it. Let's see. So I'll show the patient when I'm teaching them how to do it that you have to get the entire end glowing, so you can't see any black when you blow it, all right? So you hold the moxa stick kind of like a pencil. That's the best way to control it. And I'm going to start on this side, but I'm going to raise her arm so you can see what I'm doing, all right? So I start right here at lung 11, the Jingwell point of lung, and I'm going to be about a thumb's width away from the skin. And so I start there, and then I start painting along the lung channel, and the movement is about 1 inch per second. You feel the warmth?
Mm-hmm.
If anything gets too hot, your safe word is hot. Okay? Don't start going on like, oh golly gee, that's getting kind of warm back there, Dr. Bonnie, because by that time you'll have a 2nd degree burn. So I'm kind of making several passes here Just sort of painting along the lung channel. I'm not pausing along or over any particular points. So I'm just filling up that lung channel from distal to proximal, going up the arm. Is that feeling good? She said she loves moxa. So that was one full pass. I usually do about 3 or 4 passes up each arm. And you know you're getting the effect of filling up the channel because when I'm here with the moxa stick, you can feel the heat running ahead of the moxa, where the location of the moxa is.
Do you ever go back to the spots that feel cooler?
Not necessarily,
Okay.
but you could. I always spend a little extra time over the chest, and you'll see why when I get there.
You only go from distal to proximal?
In this protocol, yes, you're going distal to proximal. You're filling up that lung channel. So you're kind of creating a backwash of the moxa energy into that channel. Okay, I'm going to go to the other one. And you have to blow the ash off the stick periodically, or the ash will seal the coal of the stick, and you won't get the same release of the energy from the moxa. And you notice my positioning is such so that I'm not letting the smoke of the moxa go up into my face. Because if you're doing this on a bunch of patients throughout the day, that's going to get a little smoky.
Are there any benefits to inhaling moxa?
I've never heard of any damage from inhaling moxa. I don't know that inhaling the smoke is that great for you. Back in the 60s and 70s, when everybody was smoking everything they could get their hands on, Dr. Marshall tried smoking some moxa, and he said that the only thing that happened to him was he lost his depth perception for a day. So.
Do you know why I did that? Just experimentation?
Experimentation, yeah. It was the 70s. We were smoking everything.
What is that experimentation?
Say what?
In research world, we call investigators who expose themselves to investigational things large white rats.
Large white rats. I've never heard that before. That's funny. Now, the next 2 passes, or the next pass, I should say, is from lung 1 across the upper chest to the opposite lung 1. And you're going through stomach 13, kidney 27, and CV 22. I'm going to do this from this side just so the camera can see it better. And again, I'm keeping the stick about a thumb's width away from the skin, and I'm just painting along. I'm not pausing over any individual points. That's why this is a handy technique to teach to a patient, because the point location isn't quite so relevant. But I've been recommending this for a lot of my long COVID patients that are struggling with a lot of fatigue and lack of energy and that kind of thing. Now, I do usually warn the patients that this has a distinctive aroma that sometimes attracts people's suspicious natures and dim memories of the 60s. I got a nasty letter from a patient one time just telling me off that I was so unprofessional to go in the back room and smoke marijuana and come and finish her treatment. And she hadn't said a word about it when when she was in the office. Now we just need to lower her pants down to the edge of the pubic bone, okay? And again, we're just painting along. We're starting at CV2, right at the superior aspect of the pubic symphysis. And again, just painting at about 1 inch a second. Now, if they have a bra on or something like that, you can have them hold it up, or you can hold it, get it out of the way. And this is my favorite part. Can you feel the heat spreading through your chest? Yeah. So I always spend a little bit of extra time on the chest.
Dr. Bonnie, the navel CV8 is a place where you burn or one burns moxa on what?
Yeah, that's a place that frequently gets treated with moxa. Moxa on the navel is good for diarrhea
Good for
and a
cold.
lot of cold invasions in the abdomen, yeah.
When they say a cone, what exactly are they meaning, a cone?
That's the loose moxa that they mold into a thing that looks like an incense cone. I did that on myself one time. I put it on a pile of salt in my belly button. I didn't take into account that the belly button's shaped kind of like that, like a vortex. And so I got the moxa on the side and burned myself one hell of a blister on the edge of my belly button. So don't do that.
Okay. But do you use a moxa stick on CV8 routinely?
I prefer this indirect moxa method. I'm a control freak, and it helps me to control that better.
Yeah.
So anyway, to recap, you go up each arm, about 3 or 4 passes, and then across the necklace under the collarbones, and then up the front zipper all the way to there. Okay?
Do you do 3 passes on each?
3 or 4. You get kind of a feel for when it feels like it's full. When you're using moxa over the skin and you get the point full, it'll push back at you. It'll feel like a magnetic repulsion when you're putting like poles of a magnet together, and it'll actually push back at you after years of practice. All right. The other thing about moxa is how to put it out. I've had patients that have put it in their freezer. That doesn't work. I've had patients to run water over it. That ruins it. You can't tamp it out like a cigarette because it'll keep on burning. Had a patient burn a big hole in their coffee table because it fell out of the ashtray. The best way to put a moxa stick out is to smother it. Now we have these regulation moxa snuffers in the office, and all we have to do is just set it in there. You don't have to grind it, you don't have to pound on it or anything. Just put it in there and it smothers it. When I'm telling the patients that are using this at home, I tell them to take a piece of aluminum foil and mold a little sleeve, and then they put the burning stick, the burning end of the moxa into the sleeve and crimp it down so it smothers it. And that takes care of it, keeps the ashes under control too.
You know, are there any brands, I think it was mentioned before, are there any brands you recommend or don't recommend?
I can't remember the brand name of it, but the one I like has just the plain white wrap stick. Yeah, I think it is. I'll grab that box. It's sitting right on the table there.
It's the gray and green box on Amazon.
That's what I thought, but I don't want to buy it without asking. Is it green, the green one?
Yeah, because I remember
Yeah,
seeing during
this is
Grand
it.
Rounds, so that's the brand.
And I can never find
A brand.
brand name, but
Pure
they're
moxa.
pure mild moxa. And when you take them out, they've got this green label that can slide out off just like a cigar band.
It's way cheaper on Golden Needle. I looked at it, it was $7.95 per box, and on Amazon it's almost $20
Oh, yeah.
per box.
Yeah, patronize Golden Needle. They're good people. They take good care of acupuncturists. They're right here in North Carolina. They're really good people to deal with. I remember one time we were having a Tron seminar, and the person that was organizing the seminars, it wasn't me, forgot to order the needles on time. And the owner of Golden Needle, Barry Thorne is his name, hand delivered. He brought the boxes of needles up to our seminar and hand delivered them to us, and I will always appreciate that. So anyway, all right, let's break up into groups.